Hey dolls, so I'm going to do a quick video about what is in my luggage, what I'm going to be taking with me to get my surgery done. I have a checklist here so I stay on task, and I'm going to try to make this as quick as I can because I'm leaving today. Again, I'm getting a tummy tuck, liposuction 360, and a BBL, mainly fat transfer to my hips. So these are the items that I'm going to need to take with me. So in this bag, I have abdominal pads. Here. I have my Heavy Cleanse because you're going to need to wash all over. Heavy Cleanse basically takes all of the bad bacteria off of your body but leaves the good. Okay. I have some surgical tape. For my incision, I have wound wash, alcohol pads, Band-Aids, and for my wounds, bacitracin. It's like Neosporin, same thing. And for my belly button, I have some Q-tips here, and I also have some scissors in case I need those. All right, the next thing I have are my ab board. I have my back board, and I have my lipofoam. So the lipofoam is supposed to go, here, here, and here. And then you're gonna put your ab board on top of the lipofoam here. And of course your backboard goes on your back. And then you put on your faja. The next thing that I have here are adult wipes. You're gonna need adult wipes because after you take your shower the day before surgery, you cannot shower again. Until your wounds are closed, you're gonna have to use some of these, okay? I have 3 packs of these. I may take another pack, who knows? Medications. The medications that I have extra strength Tylenol. I have Tylenol PM so I can get some sleep. I have Benadryl because after the anesthesia wears off, you're gonna have some itching. I have Arnicare tablets. This helps with the swelling and it helps with the pain. Penetrex. This helps with the inflammation and the bruising. I also have a lymphatic drainage herb. I heard this is really good to help with the swelling as well. Turmeric and bromelain. Okay, that helps you to heal a lot quicker. It also has pineapple and extract in it, which helps with the inflammation, okay? I'm gonna take that after the surgery. Now for my massages, I have the Arnicare gel. I also have some sublingual melatonin. This is gonna help me sleep. And this is basically, I don't even know how to pronounce that, it's terrible. But it's to help prevent acid reflux because they're basically moving everything around. You may have some acid reflux, so this is to prevent that. I also have some vitamin C cough drops because the last thing you want to do is to be coughing after you done had abdominal surgery. You don't want to do that, so make sure you get you some vitamin C drops. I have my 1,000 milligram vitamin C here. And this is to also help with healing. I am an asthmatic, so I have my inhaler, and I also have some albuterol here in case I need to get a nebulizer treatment. I have some leftover coating, I got that for the pain. I also have a muscle relaxant. It is the Robaxin. My doctor did prescribe me that. One of the little things that they did prescribe me. Vitamin E and vitamin K oil to rub on my belly. The vitamin K helps with the bruising because there's going to be a lot of bruising because of the liposuction to prevent any further stretch marks from forming. You want to make sure that your belly is nice and supple. And then I have the Mederma Advanced for my scar. Now, you can only use this when your scar is closed. Don't use it while it's still open. That's not a good look. Next thing that I have are stool softeners. After surgery, your GI tract slows down. So you may become constipated along with the anesthesia and along with all of the iron that you are going to need to take to increase your blood stores because you're going to lose a lot of blood after surgery. And this is a form of iron here. This is Hemoplex and folic acid. You're going to need this. This helps with the absorption of the iron so that your body takes it. And it's not just going straight through your body and you're pooping it out. You don't want that. You want that iron to be absorbed. Then I also have the Mega Food Blood Builder Minis. This also helps with your blood. And I took these prior to my surgery as well because my hemoglobin has to be a 14. The normal hemoglobin levels are between 12 and 16, and my surgeon wants me to be at a 14, okay? And then B12 is also, just like the folic acid, is good to help with the absorption of iron. A probiotic. The probiotic helps with your gut flora, especially after you're having abdominal surgery. You're going to definitely need a probiotic. And the other thing that I don't have here is just regular iron pills, 325 milligrams. Depending on where your blood levels are, my blood level was at 11.8, so my doctor told me to take that 3 times a day. And I also have Floradix. I don't have it with me, but that's actually a liquid form of iron. Now, after you have your surgery, you're not going to want to have to look for anything. So this is a pill box here. You can see morning, noon, evening, and bed. So the night before surgery, I'm going to go ahead and ration out my pills so that I don't have any issues with missing any doses or anything like that. These are recover aids. I heard really, really good things about these. So you basically take these before your surgery. It hydrates you, gives you nutrients, vitamins, so that when you come out of your surgery, you're not as nauseous as people usually get. You feel a lot better. And this is what they look like here. And I got these off of Amazon. So I have 4 of these. And I also have some Quest. This has 30 milligrams of protein. You're gonna need protein for the healing process. This one is salted caramel. I love me some caramel. And then this one is just plain old vanilla. Again, because I am an asthmatic, and you're gonna need this anyway if you're getting a tummy tuck. This is like a spirometry, okay? So after you have your surgery, when your surgeon sews up your abdominals, it's gonna be really tight, and you may have difficulty with getting air in. So what that does is it forces you to deep breathe. You wanna deep breathe because you do not want pneumonia, honey. You do not want pneumonia after your surgery. You will be snatched, but you won't have pneumonia. We ain't got time for that, okay? So get you one of these. I also have a urinal. So when you have your surgery, you are gonna be in a lot of pain. You're not gonna wanna sit. So just basically put this up under you. Your faja already has an opening, so you don't have to worry about taking your whole faja off, and use that. And another thing, because you're gonna have some difficulty getting air in, I have a pulse ox machine here. I just wanna make sure that I monitor my oxygen saturations because, honey, if they go below 95%, you in trouble, okay? So, and I heard that at the clinic, they only take your vital signs once. Yeah, crazy. Unfortunately, my cycle is going to come on, so I have pads. I'm gonna also use these to stuff my faja. If I have swelling in a certain part of my belly, I'll just roll these up, put it inside my faja, and it'll press against that fluid and help that to come out of my pee, basically. I have chucks. Honey, after you get liposuction, you're going to be bleeding, okay? You're going to be bleeding, so you're going to need something to put up under you, especially those first couple of days because it's not going to be pretty, honey. Not. I got me some good old hospital grade hand sanitizer. Anybody that touches you, period, needs to wash their hands, use hand sanitizer, especially if they're helping you with your wound care. And they also need gloves. Do not let anybody touch you without gloves on, okay? The last thing you want is to have an infection in your incision, and you're gonna have totally different problems. You can become septic, which is basically an infection in your bloodstream, and you can die. So I wanna stress that enough. Make sure people have on gloves whenever they are coming near your incision sites. That's your here, that's your lipo incisions. I also have some hospital grade, they're like Lysol wipes, but they're a lot more stronger because they're hospital grade. So when you get to your recovery house, you wanna wipe down everything because you don't want an infection. Because you're going to be itchy after surgery, you wanna have a back scratcher. These are back scratchers here. They extend. So they're also good if you need to reach something, you can use these to grab it. I also have an extension cord. You are definitely gonna need an extension cord. I got my boppy. I got this off of Facebook Marketplace for $5. There's no need for you to go out and buy you a whole new one. Get you one of these and you'll be good. Now let's talk about safety. What's that look like to y'all? A Bible, right? Wrong. It's a safe, girl. It's a safe. So you want to be as discreet. I actually got initially a regular looking safe, the safe that everybody gets, but it was broken, so I just sent it back. And then I saw on Amazon that they have books that look like safes. So that's why I got that. Nobody's gonna want to steal a Bible. I also have some gauze, and like I said before, I'm gonna come on my cycle. Now I use these when I was after my delivery of my kids. I had 3 C-sections. These, honey, these mesh panties are life. Like, you can pull them up so they're not cutting in your incision. That's the last thing you want. So I'm gonna use these when I come on my cycle. And then of course you have your regular toiletries. You need some chapstick, you need some deodorant, you need lotion, toothbrush, toothpaste. Dial soap is the only soap that you can use besides the heavy cleanse because it's antibacterial soap. You need that. I bought 3 washcloths, compression socks. When you have surgery, your circulation slows down, which means that the fluid that you collect anywhere has difficulty getting back up to your heart to get flushed out. So you're going to need compression stockings. You do not want what we call a DVT, deep vein thrombosis, which is basically a blood clot in your lungs. In your legs, because it can travel up to your lungs and you can die. So get you some compression stockings. Get you a couple of pair. And I have my faja here. This is my 2nd stage. They're going to put on a 1st stage after your surgery. And then after a couple of days, they're going to put on your 2nd stage. This one is more firm. It's going to hold you in. So yeah, I bought this off of Amazon. I think it was like $50. And so my custom faja gets made. Now under your faja, you want to have on camis. I have 5 of these. I got these from Rainbow. They are seamless. So usually the tanks have the seam down the side, like here. These don't have that. So you won't have that indentation on your skin. I have my hospital gown. This one, I got this from Roses. This one buttons down in the front. Here, it has buttons. Okay, you don't want to have to put anything over your head. I also got 2 more dresses. Got me some slide-ons. Do not get no flip-flops, but you gotta have the thongs. Do not get them, because you already gonna be in enough pain. The last thing you wanna worry about is getting your foot in a daggone flip-flop right. Some shower shoes, okay? Bring you some regular socks to put over top of your compression stocking. All right. And then I also have some sports bras. Probably really won't need them unless I'm going out because I'll have on my tank. Oh, also like face wash, face lotion, hair moisturizer, shampoo if you need to shampoo your hair, a bonnet because I'm not going to let my locks get all dry and crispy over there. A robe. Also get you a dark one. A pen and a pad in case you need to jot anything down, especially when you go for your pre-op appointment. There are some things that your surgeon may need to tell you, so you can jot those down. Cell phone charger, of course. I went to Five Below. They have the 10-foot chargers. You want to get one of those because you don't know how far the outlet is going to be from you. You're going to need a backpack. The backpack is to take when you go to surgery, so you can pack everything in there that you need. Oh, I also got a heated blanket. When you come out of surgery, because they have opened you up, you are exposed to all that cold air. It is cold as I don't know what in the operating room. So when you come out of surgery, make sure that you have that your heated blanket plugged up and ready to go because you won't be shivering, girl. You don't want that. Any books that you want to take, an umbrella. Next week it's going to rain tomorrow and the day that I actually go for my surgery, so I'm going to need an umbrella. If after you take antibiotics you tend to get a yeast infection, see if your provider can prescribe you diflucan, because the last thing you want is to be sticking some monostat up in your kitty cat, and then you know that stuff just comes out. It was just too much. Get you some diflucan, honey. Right, and a sweater. I get cold. You're also gonna want a water bottle. You want to stay hydrated to flush all those toxins out and flush all that swelling out. You wanna get mine is 32 ounces. So I'm gonna try to drink at least 4 of those a day. Oh, you're gonna need an outfit for surgery day, just when you go to get your surgery. And then that's when they're gonna put on your gown after the surgery. Headphones. Last thing you wanna do is to be irritating your roommate because you don't have no headphones in. That's rude. Get you some headphones. And that is it. So I'm also gonna do a video when I come back, just to let you know exactly what I use, but I think that I am pretty covered here. Let me know if you have any questions. Let me know if you believe that there's something else that I should take. Just let me know. Don't forget to like and subscribe. And also follow me on Instagram, nurse_poison with a Z_Ivy. All right, I'll see you all on my next video.